As we age, muscle aches become more common. Simple activities like gardening or long walks can leave us sore for days. This is largely due to sarcopenia, the gradual loss of muscle mass and strength, making muscles more prone to strain and slower to recover. Everyday overuse, minor injuries, and even common illnesses like the flu can trigger lingering discomfort. Some medications, such as statins for cholesterol, may also cause muscle pain as a side effect. Chronic conditions like fibromyalgia or polymyalgia rheumatica can lead to persistent, widespread muscle pain that requires medical attention. Understanding these causes is the first step to managing discomfort and staying active. Let's explore practical ways to find relief. Muscle aches and pains are a common part of life, especially as we age. The good news is that most of these everyday discomforts can be effectively eased right at home without needing to rush to the doctor. A great first step is to remember and implement the RICE method. Rest, which means avoiding activities that aggravate the pain. Ice, apply ice packs for about 15-20 minutes at a time, several times a day. Compression, use a bandage to gently wrap the affected area to reduce swelling. And elevation, keep the injured area raised above your heart whenever possible for acute injuries. After the initial pain subsides and the acute phase is over, gentle movement and light stretching exercises help restore flexibility to the muscles and speed up the recovery process. Self-massage with a tennis ball, focusing on the affected area, or foam roller, can also provide relief. These tools can release muscle tension and soothe those sore spots that bother you. Staying hydrated is crucial for overall muscle health. Dehydration can worsen muscle cramps and tightness, making the pain even more pronounced. Incorporate daily stretching into your routine, even just 5 minutes in the morning, to maintain muscle flexibility and prevent future pain and stiffness. Always listen carefully to your body and avoid any movements that cause sharp or intense pain. These simple habits, when practiced regularly, can make a significant difference in how your muscles feel from day to day. Consistency is absolutely key when it comes to achieving long-term muscle comfort and preventing future issues. Now let's briefly talk about over-the-counter pain relievers and when it might be appropriate to consider using them. Over-the-counter pain relievers, readily available at your local pharmacy or grocery store, such as acetaminophen and NSAIDs, can be a helpful tool in managing everyday aches and pains. They can provide much-needed relief when simple home remedies like rest, ice, or heat just aren't quite enough to do the trick. Acetaminophen is often the best choice for general aches and pains, such as headaches or muscle soreness. On the other hand, NSAIDs, or non-steroidal anti-inflammatory drugs, are particularly effective at targeting inflammation, making them a good option for strains, sprains, or swelling. However, it's crucial to use these medications carefully and responsibly. NSAIDs, in particular, can sometimes affect the stomach, kidneys, and even blood pressure, so it's important to be aware of the potential risks. These effects can be more pronounced and require extra caution, especially in older adults. Always, without exception, carefully follow the dosing instructions provided on the label or by your doctor. It's also essential to consult your doctor or pharmacist if you have any chronic health conditions, such as heart disease or diabetes. This is especially important if you are currently taking other medications, including supplements, to avoid any potential interactions. Remember that pain relievers are generally intended for short-term relief of acute pain. If you find yourself needing them consistently for more than a few days, it's a good idea to talk to your healthcare provider to determine the underlying cause of your pain. It's also important not to ignore persistent or severe pain, as tempting as it might be to simply mask it with medication. Relying solely on medication can sometimes mask underlying issues that require proper diagnosis and treatment. To minimize potential side effects, always use the lowest effective dose of pain reliever, and only take it for the shortest time possible to achieve the desired relief. Now, with those guidelines in mind, let's cover some specific situations where it's particularly important to seek professional medical advice. It's important to pay attention to your body and understand when muscle pain requires more than just home care. Seek medical advice. If muscle pain is severe, sudden, and debilitating, don't hesitate to seek immediate medical attention. If the pain lingers or doesn't improve after a few days of consistent self-care, it's time to consult a healthcare professional. Warning signs that warrant a doctor's visit include significant swelling in the affected area, redness or increased warmth around the painful muscle, or the presence of a fever. These could signal a developing infection, a more serious underlying injury, or another medical condition that needs prompt treatment. If muscle pain starts shortly after beginning a new medication, it could be a side effect. In this case, don't stop taking the medication on your own. Call your doctor as soon as possible to discuss potential alternatives and ensure your safety. Persistent muscle pain that doesn't go away with rest and home remedies may be a sign of underlying chronic conditions like fibromyalgia, a condition characterized by widespread musculoskeletal pain, or polymyalgia rheumatica, an inflammatory disorder that causes muscle pain and stiffness, especially in the shoulders and hips, both of which need professional diagnosis and management. Trust your instincts. You know your body best. If the pain significantly interferes with your daily life, prevents you from performing normal activities, or simply feels unusual and concerning, don't hesitate to get checked out by a medical professional. Early intervention and accurate diagnosis can lead to more effective treatment and better long-term outcomes. Ultimately, seeking medical advice when needed can provide reassurance and peace of mind. Remember, most muscle pain is manageable with self-care and lifestyle adjustments, but knowing when to seek professional help is crucial for maintaining your overall health and staying active. Take good care of your muscles. They'll thank you for it by keeping you moving and enjoying life to the fullest.